of the paranasal sinuses, isn't it? So in this paranasal sinuses, in the diagram you can see one, that is sphenoidal or frontal sinuses, three ethmoidal sinuses, 4, 5, 6, 7, or 8 and 9 are all constituents of nasal concha, or they constituents your ethmoidal bone or ethmoidal sinuses. And the two, which is the largest of all the paranasal sinuses, it's also called as maxillary sinus. Why it is called maxillary sinus? It is because it occupies
Sir,
maximum
slides are
volume.
not.
Now is it okay? It is a maxillary sinus. It occupies maximum volume in the maxillary bone. So that's why it is called as maxillary sinus. So it has been named after a scientist called as Highmore. That's why it's also called as antrum of Highmore. Okay, and among all these paranasal sinuses, it is the first sinus to develop in the cavity. So coming to the anatomy of maxillary sinus, it is nothing but the horizontally pyramidal shape. So horizontal pyramid. When you rotate the pyramid to the horizontal, the apex will be pointed towards the lateral wall, that is the facial wall, towards the zygomatic bone, and the base is towards the medial side. So when you imagine this diagram in a three-dimensional way, okay, the apex which will be pointed at your zygomatico-maxillary buttress, the zygomatico-maxillary buttress, and the base is nothing but formed by your lateral wall of the nose. Okay, so it's a horizontal pyramid consists of base and apex and four sides. Okay, base is the vertical lateral wall of the nasal cavity, apex junction of maxillary and zygomatic bone. Okay, these two are very important because when you expose the maxillary bone, the whatever the wall you're seeing is nothing but the facial wall. The facial wall it will be there, whereas you don't see any apex there. Okay, coming to the medial wall, it also refers to the base of the sinus formed by the lateral wall of nose, so which constitutes of concas, inferior nasal concha, perpendicular plate of palatine bone, uncinate process of ethmoid bone, and descending part of lacrimal bone. Okay, it also has huge significance because the inferior nasal concha. Okay, so it is the inferior most part which is lying just above your nasal floor. Okay, so whenever you have any defects of maxillary sinus, the entire sinus will be filled up completely, blocking the opening of the maxillary sinus. We all know that maxillary sinus open in the middle nasal concha. Middle nasal concha. So middle nasal concha there is an opening. It's called as ostium. So when there is any infection in the maxillary sinus, all this ostium will get blocked. So when you remove all the content, you create an additional opening through the inferior nasal concha, which is present on the base of the sinus. So this procedure is mostly done whenever you are operating any pathology related to your maxillary sinus. You create an additional opening into the maxillary sinus through inferior nasal concha, so that all the contents which are present within the maxillary sinus will be emptied out through this additional opening. Coming to the superior or orbital wall. Superiorly, it is formed by the floor of the orbit. The roof of the sinus is nothing but the floor of the orbit. The superior wall is the most vulnerable among all sinus. Why? Because it is the most thinnest and weakest and easily traumatized part of the maxillary sinus. Okay, so what is the significance of this? Because it is very thin, very delicate, and very vulnerable, whenever any pathology extending in the maxillary sinus, it is the one which is the most susceptible to get that involved within the pathology. For example, if you are gone for any tumor involving the maxillary sinus, it will grow to the entire volume of the maxillary sinus, and because of the thinness of the floor of the orbit, it has a chance for exploration to the orbital volume, so orbital globe. So it will go into the orbital globe. So ease of spread is more when there is involvement of huge volume of the orbit. Coming to the anterior wall, facial wall. So it is nothing but the anterior aspect of the pyriform aperture medially to the zygomatic suture laterally. So infraorbital rim superiorly to the alveolar process of maxilla inferiorly. These are the boundaries. So it's nothing but constitutes your anterior wall of maxillary bone. Okay, so it is in a concave shape, convex shape. Thinnest portion is over the canine fossa. And what is the significance of this anterior or facial wall? So whenever any pathology is involving your maxillary sinus, the only way where we can go into the sinus is through this anterior or facial wall. So this is the only wall we can expose intraorally. By reflecting all the mucosa, whatever the first part will get exposed is nothing but your anterior wall of the maxillary. Through this anterior wall, we cut through the anterior wall and go into your maxillary to remove any pathology within the maxillary. Coming to the posterior lateral wall, it is a wall which is not visualized by us. It is made up by the zygomatic bone and greater wing of sphenoid bone. So it is present far behind. So your finger cannot go behind that. So it has the important constants includes your posterior superior alveolar vessels, sometimes in close contact with the sinus mucosa. Why? Because distally you have maxillary tuberosity. So this maxillary tuberosity ends with the pterygopalatine bone. So here what will happen is the maxillary thickness will be very very thin. So at the posterior lateral aspect, what will happen is because of the thinness of the posterior portion of maxilla, your entire sinus will be occupying near to the alveolar ridge there. So it is a very, very thinnest at the posterior lateral wall. Coming to the floor or the buccal or alveolar wall. Okay, it is the thickest of all the walls of your maxillary sinus, formed by the junction of sinus wall and lateral nasal wall. And in this, you have multiple septa dividing into multiple segments of maxillary sinus, which you can visualize in your common orthopantomograph. You can see multiple scalloped margins of your sinus in the floor of the orbit. Okay, it is usually present 1 to 1.5 centimeters below the nasal floor. So it is always below the nasal floor. Remember that. Okay, so creating of oroantral fistula, which is one of the important aspect we need to cover in this chapter. So the chances of creating oroantral fistula. Why the oroantral fistula is formed? Because your this floor of the buccoalveolar wall is nothing but having your teeth. So, and you go from anterior region to the posterior region at the junction of second and third molar, or usually at the second premolar to the third molar. Your sinus will dip between the roots because there will be the interradicular bone will be very thin. Okay, so here you will see sinus is almost touching your alveolar bone. So whenever you try to extract this upper second molars or upper first molars, you will see patient immediately saying that blood is coming out from my nose. Okay, or else he'll come to the next 3 4 days and he'll complain you that whatever I take liquid foods, it's coming through my nose. There's nothing but there's a communication which is formed from the oral cavity to the nasal cavity. Okay, which is coming through the maxillary sinus. Okay, coming to the proximity of the sinus to the roots. So coming to the descending motor, so first molar palpal root is almost in junction with your maxillary sinus, followed by second molar, followed by first molar and third molar, and to the least will be the canine. Okay, so there is a chance for formation of oroantral fistula from first premolar to the third molar. Okay, and the most commonly will be your third molar, will be the most common. So coming to the physiology. So what does this sinus contain? What does the sinus have? Why the sinus is formed? The functions of the sinus includes it will decrease the weight of the skull, it will impart resonance to the voice, and it will humidify and warm the inhaled air. So it is lined by a respiratory epithelium, which will be continuing with the nose and other paranasal sinuses, and the mucoperiosteal lining That is the epithelium, which is which is lined. The entire sinus is nothing but the pseudostratified